Right. Good afternoon, ladies and gentlemen, and welcome to the third day of sessions at the Healthcare World Festival. My name is Steve Gardner. I'm the Managing Director of Healthcare World, and I'm very pleased to welcome you to this afternoon's event, where we're very proud to have Marta Garcia, who is Head of Healthcare Procurement for the UN, as our speaker at this afternoon's breakout session. Marta is going to give us a short presentation explaining the workings of the UN from a healthcare point of view and what opportunities exist and how to access them for the UN. So without any further preamble, Marta, over to you.
Thank you so much, Steve. It is a pleasure on behalf of the UN Secretariat to be here with you today and to share some information and highlight a little bit of what the UN is about, demystify how huge the UN system is, and dive a little deeper into healthcare procurement within the UN operation. So I have a short presentation I'd like to share with you all that will provide a little bit of feedback of who we are and what we're doing. And I'm going to start this presentation now. So the UN, the United Nations Secretariat, in a way, is a very big organization, very, very big. And it tends to be a little bit of an overwhelming organization as well. The UN is composited of many, many, many different organizations. And in order for us to understand it, we need to understand the purpose of the UN. So the UN has three purposes: maintain international peace and security, promote economic and social development, and promote human rights. UN peacekeeping within the UN Secretariat, our role is to help countries navigate the difficult path from conflict to peace. We have the legitimacy and the burden sharing ability to deploy not only uniformed personnel, but civilian peacekeeper to address a range of mandates for the UN Secretary, Security Council, and General Assembly. With that, we provide over 130,000 peacekeepers to actively prevent conflict, reduce violence, strengthen security, and empower national authorities to assume the responsibility of a peace-building strategy and to lay the groundwork to sustain long-term peace. When you try to sustain long-term peace, then you promote economical and social development, and you ensure human rights are respected. So that's our role. The United Nations Secretariat is very different from UNICEF, from WHO. Our role is to be there in the most difficult places and navigate that path from conflict to peace. And that's where healthcare procurement will come in, as we support the work that these people are doing in the field. To understand the UN, it's important to know how to work with them. It's important to know where are we. We're located everywhere. The UN is made up of different organizational entities, what we call funds, programs, and specialized agencies, and the Secretariat, where the United Nations Procurement Division is located. With us, you have a different set of mandates, and with different agencies, the mandates will come in. So specialized agencies have a distinct and separate mandate that covers political, economical, social, scientific, technical, and humanitarian fields. The mandate, for example, the WHO has in healthcare is much different than the mandate the UN Secretariat has. WHO has a mandate to integrate itself with the ministries of health and support the development of ministries of health. What the UN Secretariat does is actually support its own primary care and healthcare operations to ensure that we don't tap in or we don't overwhelm national health systems with our operations. In a way, we need to be independent so we don't affect the countries we're working in the healthcare perspective. What you need to do to know what UN agency you have to work with is to find the best match. Depending on what goods or services you offer, you identify the UN organizations that will procure the goods and services that you're offering. And sometimes there's an overlap on several ones, like the UN Secretariat, UNICEF, UNFPA, and WHO, all buy healthcare products and services, but for different purposes and in different quantities. So depending on the size of your company, depending on your experience, you need to find what organization is the best match for you. The idea today is to provide you with information to see if the UN Secretariat is the best match for you. The United Nations Procurement Division is within the Department of Operational Support and within the Office of Supply Chain Management. The Office of Supply Chain Management basically covers anything that you need to do to support rapid and effective solutions for peacekeeping, special political, and other field missions in the world in complex environments. We administer a combined annual budget of over $7 million, and we serve in over 270 duty stations, very directly and indirectly, and across over 30 countries. We have different peacekeeping and special political missions operations. So within supply chain management, there's a whole lot of support, but within it, we also have the procurement and logistics support, which is what we're going to focus on today. So the vision that we have for the Office of Supply Chain Management is basically to provide efficient, agile, responsible, and accountable end-to-end supply chain solutions to our partners. And basically, we need to provide the people in the field who are doing the difficult work with the best solutions, the best product, the best services, the best time possible. And that is our vision, to fulfill their mandates, help them fulfill their mandates by providing goods and services when they need them, where they need them, at the best price, and as they need them. And that's the interest of the organization, to always support these operations to make sure they're successful. Where do we work? As I said before, we're located in over 270 countries, directly and indirectly, but we focus our work in 36 peace operations in over 30 countries. We have different places that we work in, but we concentrate more on the African and Middle Eastern region. We have some operations in the Americas as well, but a very, very small scale, as well as in headquarters in New York. So peacekeeping procurement and the healthcare supply chain is super important because we are the link into life-saving services. What we do is that we fulfill the needs for the mandate of making sure all peacekeepers, being uniformed or civilian, can have access to healthcare, primary healthcare, and life-saving healthcare. Basically, if you're wounded in the field before you need to be stabilized, that's the type of procurement we're doing. We're supporting hospitals and small clinics to be outposted in places where sometimes you can't even access it via road, and you have to access via air. So it's really important that what we do is always just in time to support these operations. The UN Secretariat procurement volume is very high. It's about, between the different years, $2 and $3 billion. Last year, it was $2.7 billion. And out of that, $61.7 million was the pharma and health category. Specifically, British suppliers have a nice volume within these $2.7 billion. Last year, we bought $95.6 million from British suppliers, and only $4.2 million in pharma and health category, which is why we're here. We're trying to encourage you to check our opportunities and see if it's the best fit for you and actually bid, because we know you have great suppliers and vendors that might be great for our organization. And on that note, I want to tell you about what the major commodities we procure are. We buy everything, as I said, that you need to replenish an outpost clinic, a level 1, level 2, level 3, level 4 clinic, depending if it's civilian or uniformed personnel. But we make sure that all pharmaceuticals, drugs for surgery, basic care drugs, drugs for malaria, medical consumables of all sorts, sutures and bandages and needles and syringes, medical equipment from the most complex digital x-rays and ultrasound machines to laboratory equipment, blood products as well. As I said, the work that people are doing down in the field is basically life-saving. So sometimes we do blood transfusions and we buy actual whole blood to make sure people survive and are ready to be evacuated into a long-term healthcare facility. We also purchase vaccines of all type because we run our own vaccination program. Currently, the UN is running its own vaccination programs in countries where the local health system is overwhelmed. For example, in COVID-19, we are running our own COVID-19 vaccination program just to cover certain countries where there isn't enough access to vaccine for local nationals. So we don't want to overwhelm their systems, and we're trying to ensure that our personnel is also vaccinated to make sure that we control the pandemic from our side, that we're not the ones that actually bring it in. So we're also conducting our own COVID vaccination program, but we conduct a full vaccination program from flu vaccines, hepatitis vaccines, yellow fever, anything and everything. We conduct our own vaccination programs just to make sure that we're not overwhelming the national stocks of any country we're operating in. And finally, we also do a lot of outsourcing of medical personnel. There comes moments where we don't have enough personnel to staff our level 1 and level 2 hospitals. So we outsource medical personnel. We bring surgeons in, we bring doctors, epidemiologists, in this case for COVID, when we started working on the COVID-19 pandemic last year. And we also outfit helicopters with aerial medical evacuation teams that go to the most difficult places and pick up wounded personnel or personnel that is in very bad shape, and takes them to get further healthcare in bigger facilities from our side. So we have a wide range of healthcare procurement, and it's important for us to mention, of course, that we also have dental equipment and mortuary supply, which we also do, but we run a full range of medical support, so we purchase any commodity that is available in the healthcare world. We have big challenges in the pharma and health procurement, and therefore we're trying to improve them by finding efficient, client-oriented, and accountable contractors. What we are trying to find is contractors that will partner with us and understand the importance of the work that we're doing and help us minimize these risks. One of the biggest risks we have found in the past years is the risk of counterfeit products. So finding responsible, accountable suppliers that have a reliable supply chain, be it wholesalers or manufacturers, is very important for the UN, as what we do in the healthcare world affects directly the lives of the people that we're treating. That's why we need suppliers that are either wholesale manufacturers or connected through a strong supply chain with specialized manufacturers that would provide us with the best items at the best quality possible in the shortest time and at a good price. Another challenge we find is cold chain shipping. We're also trying to engage with suppliers that have great relationships with freight forwarders that will ensure cold chain shipping. From end to end, sometimes we send pharmaceuticals and even blood to places where airports don't have air conditioning, where transporting items into the actual mission compound in a very high heat environment. We need a strong cold chain to make sure that the items that we're purchasing arrive at the place that we're going to need them in intact condition. And providing things efficiently, agilely, and accountably helps us with demand management. What we usually do is we conduct solicitations to have contracts to help us replenish our stocks in stores. We do a lot of demand management and inventory management and distribution as we receive in certain compounds and then send out to different places in outposts. For example, in Somalia, we have a main office in Mogadishu, but we send out to all the clinics that we have in different sectors in Somalia. So having a just-in-time, efficient, and agile supply chain from our side with our contractors makes sure that we always have everything we need in all of these outposts. And that's why we always try to lean to multiple sourcing, because we need to avoid supply chain disruptions. In the last years with COVID, the fact that we had multiple sources for the same products in healthcare provided us with the opportunity to not have an interruption in our supply chain in items like PPE and ICU equipment. We were able to source from our different suppliers the things that we needed to respond to the COVID-19 pandemic. We're also looking for suppliers that are keen in innovation and alignment with our agenda of sustainable development, that look for items that are last longer, that are stronger, that are reliable, so we can have an investment in these items, and especially equipment that will help our missions for a very, very long time. During the last couple of years, the UN has been leaning towards finding different types of suppliers and doing a category management strategy to understand how we can improve the services we provide to our clients. So we're trying to understand and look at the whole purview of the products and services that peacekeeping, political missions, and UN entities needs, and to center our procurement into catering to the routine and emergency requirements. So we need to cover routine replenishment of stocks in stores, but also have a stock that is dependable in case of emergencies, which we have seen that procurement of healthcare has been put in the forefront in the last year with the COVID-19 pandemic. And therefore, we have established processes to ensure adequate stocks are always available, with an adequate warehouse management system, but we rely on our suppliers also having an adequate warehouse management system where they can provide us with clear timelines of delivery that will not change terribly as we are depending on our suppliers for the replenishments of our stores. And that's why the UN sets up contracts to ensure the relationship with the vendor. Our solicitations are done every 2 to 3 years. Depending on the success of the contracts, based on forecasts and estimates. Why? Because we're trying to have a relationship established with multiple suppliers and not conduct this very complex solicitation process every year. So instead, we look at our forecasts and we set up these framework contracts that we call global systems contracts that will serve every mission in the world. And we don't commit officially until an order is placed by our missions, but you have insurance that you are the UN supplier and that you will be contacted for the procurement when you have a contract with the UN. And that's to increase the access for missions. And what we do in our solicitations is increase that access through quality products. So contractors are awarded a list of items and missions place specific orders. So your relationships is not only with headquarters. If you have a global systems contract, your relationships is with the missions as well. And that client orientation and that agile supply chain that you bring and that you will provide to us will also be evaluated by these missions. It's also important to mention that the UN has embargo exceptions for the delivery of goods. I'm sure you saw in the map that I showed you that there are countries that sometimes have embargoes, but the UN has agreements with the host nations where we're working, where we can bring in pharmaceuticals, medical consumables, equipment of any sorts that don't need to be registered in that country, as long as they are only being used by the United Nations. The mode of shipment, for example, for drugs is air, and for consumables as well. For big ticket items like equipment, sometimes we consider sea. And our Incoterms are usually FCA for regular orders and DAP for emergency orders. Sometimes we need to deploy a mission very, very quickly, or open up a hospital very, very quickly because there's a tragedy that has happened. So sometimes we will depend on your good relationship through your whole supply chain to supply in emergency orders as well. And packing in accordance to good distribution practices, looking at recommendations for transfers of dangerous goods and IATA rules, and knowledge of that with your supply chain is super important for us as well. Quality standards are fundamental in the healthcare procurement that the UN conducts. In items where there's compliance with WHO good manufacturing practices, distribution practices, that's what we're looking for. We're looking for, in our solicitations, you will always see that we request international quality certifications, not only for the company, but for the manufacturer that is manufacturing the products that we are purchasing. That's where the GMPs and the GDP comes for drugs, and for example, ISO's certificates for manufacturers of health equipment or equivalent, if there's national authorities that provide these as well. For us, we need to assess the quality of the item before we even award a contract to ensure that the missions will receive the best quality items that we're purchasing. Sometimes we will require certificates of origin and analysis and information on narcotics or controlled substances, because we do the we go for FCA. We always do the import licensing. And for import licensing, sometimes in different countries, we require from different documents. So suppliers that are interesting to work with us should be able to provide these documents to us when we need them. They're not always mandatory, but in some cases we will request them. One of the key elements that need to be considered for suppliers that are watching this that sell pharmaceuticals and medical consumables is that we request a shelf life at the time of shipping of at least 80% of the shelf life. So a good relationship with your manufacturers, with your wholesalers, or if you're a manufacturer, that you have to ensure to us that we get the longest shelf life possible. Because remember, we're shipping this out to places where it's very difficult to sometimes replenish, and we have to wait a long time to replenish. So the longer the shelf life, the better for us. And making sure that labels are in English language, or at least have an English language translation, is really important to us. And notifying us when any item, be it drugs or equipment, is withdrawn for certain circulation is super important as well. A big chunk of this is communication with our vendors. So we have a couple of upcoming tenders that we will be issuing out in the next 2 to 6 months. So I wanted to share a little bit of information on that so you can keep your eye out on these. And we're going to start with medical services. We are going to issue out a tender for area medical evacuation teams to be embedded in aircraft that are hired separately. And damage control surgery teams. The damage control surgery team is an outpost clinic that is meant to conduct surgeries and stabilize wounded personnel, be it civilian or uniform, and keep them in an ICU setting until they're ready to be evacuated for further treatment. So those are really important for us because those are one of the life-saving services that we outsource as well. And we're also going to be issuing out a request for proposal for medical personnel to staff a level 1 or 2 hospital. That's still being decided, but basically it's to staff it from end to end, from electromedical technicians to surgeons to anesthesiologists, anything and everything. It's a conjunction of personnel that is required to staff a whole hospital. We're also going to go out to update our global systems contracts for pharmaceuticals and vaccines. So most certainly we'll be issuing out invitations to bid for goods, for drugs for surgeries, drugs for malaria, all types of vaccines, and we're still looking for COVID-19 vaccines. So that's something that we're always interested in as well. And we will be conducting solicitations for this during the next 2 to 6 months. And finally, medical equipment and consumables, we are going to be issuing out a solicitation for diagnostic equipment, laboratory equipment, reagents and consumables, as well as the maintenance and the spare parts for all the equipment, rapid test kits like HIV rapid test kits, sutures, and ICU equipment, ventilators, oxygen concentrators, infusion pumps, everything that is needed to our outposts that are treating COVID-19 right now. We're still interested in setting up a contract just for that as well. And because I've talked to you a little bit about the upcoming tenders, I want you to understand a little bit how the tenders will be conducted and the principles that will guide them. So the United Nations, the whole procurement process from end to end of the cycle, these principles are embedded in everything that we do, in our policies, in our procedures, and in our solicitations. And one of the key ones is best value for money, which is the optimal combination of quality and cost. What does this mean? That we don't always buy the lowest cost item. We don't always buy the cheapest. We buy the combination of compliance with requirements that, as I said, we look for the highest standards of quality and performance and reliability, but also combined with cost, but not only purchase cost, actually the total cost of ownership. We want to avoid just having the tip of the iceberg, and we want to be able to see the whole cost. And that's how we considered an award of a contract, by looking at this optimal combination. And something that's super interesting for new suppliers is to understand that we are the stewardship of the United Nations in any UN agency is fairness, integrity, and transparency, which is basically impartial treatment of our suppliers. You have all access to the same level of information. The same procurement opportunities are published so anybody can see them, and you have access to reading our policies and procedures because they're public. Our procurement manual is public. If you want to download it and read it, you will know exactly how we make our decisions, how we award our contracts, how we prepare our bidding documents. It's all very transparent. Effective competition for us is fundamental. Fostering competition for the United Nations is the key to achieving that best value for money that I talked to you before. How? By identifying as many prospective and independent and complete bids as possible. Our idea is not to have two good bids. Our idea is to be able to identify bidders from all over the world that have different solutions, and that we can see that competition reflected in these bids. And finally, the interest of the organization is super important. Sometimes you will see criteria that is derived by the objective of us assisting our clients and to fulfill our goals and mandates. Let's say we have an emergency clinic that needs to be set up. Part of the criteria that we're going to use is lead times of delivery. Not only is it going to be price, but it's also the lead time of us being able to set up that clinic in time. So you always have to consider that each procurement process is different from the other, and that because something worked for one doesn't mean it will work for the other, but that all these principles will always be embedded, and that when you read a procurement solicitation, you will see slivers of all these things there. So the principles, of course, are applied through all the procurement process. Finally, I wanted to share with you what I consider the takeaway of this. If you have never been a UN supplier, or even if you have been a UN bidder, but you have not been successful, I want to give you the key success factors that we believe in the UN will allow you to move to the next level, either be a supplier or even be awarded more contracts if you have already been. And the first one is to be prepared as a company. First of all opportunities are published in the United Nations Global Marketplace. Therefore, it's important to register. The United Nations Global Marketplace is a global vendor portal. And just for the United Nations Secretariat, I'm not going to speak for all the organizations, registration is mandatory for all commercial vendors. Why is that? Because our ERP system actually feeds off the United Nations Global Marketplace database. So in order for us to actually invite you to a bid, we need to be able to identify you in the ERP system. Therefore, you need to be registered in UNGM. You could be registered at the basic level, which is, it takes about 5 to 10 minutes to register at the basic level, but it's fundamental so we can invite you for further opportunities. Vendors are also can also use this portal to introduce your products and services not only the Secretariat, but other organizations, other countries, other regions. It's a gateway, basically, to the UN, to understanding the UN, and making sure that you can work with the UN. The UNGM also enables vendors to keep abreast of upcoming tender notices. And there's two ways you can do that. First of all of our expressions of interest and all of our requests for information are published in UNGM. So when you register, it asks you to pick your commodity code. What do you sell? I always say that it's super important for new suppliers to register with the right commodity code. And if you don't know what the right commodity code is, try to register at the highest level so you at least don't miss out on opportunities. Because we check this database to invite you directly to expressions of interest, but you can also be checking every day in accordance to your commodity code or every week to see if there's new opportunities that are published there. And picking the right commodity code is super important. As the UN buyers, also check this database to invite you directly to participate in expression of interest and request for information. Having an email that is not a specific person, but maybe a generic email for your company is fundamental. I'm saying this because sometimes it happens that we invite certain companies that we think are suited for an expression of interest and they never respond. And then when we meet them, maybe in a one-on-one or a business seminar or a festival like this, they said, oh, I've never gotten an invitation. And maybe we recall that we did. It's because that person maybe no longer works there, and that person opened up the account, and instead of using a generic email for the account that somebody else can access if that person no longer works there, it's that email of that person that doesn't even exist. So my advice, don't use a personal email, use a generic email from the company, like attenders@yourcompany.com, and to ensure that you don't lose that link with the buyers that are always checking the database. Another good way to check what opportunities there are out there and to keep abreast of business opportunities is the UN Procurement mobile app. The Secretariat has actually built its own app that you can have on a tablet or a smartphone, where you can access information related to all business opportunities, business seminars like this, contract awards to understand what we are buying and how much we're buying, event calendars like tender openings if you're already participating in a tender, and our purchase order and contract monthly awards. This is very important statistical information that can give you an idea of where the UN is going and what we're buying, to see if you can sell to the UN, because if we've already bought it, it means that we will buy it again. So it gives you an idea to prepare yourself. It also has access to all our rules and regulations and data, and it's very easy to use. It's simple, and it's available on all the platforms, on iOS and on Android. There's also, to understand what the UN buys, not only from our site secretariat, but from other, UNGM also has a knowledge centers where contract awards from all UN agencies, not only the UN Secretariat, are published, and knowledge centers that let you learn about procurement in general. Remember when I said that our policies and procedures are public? Well, there's a UN procurement practitioner's handbook. There's information on how we conduct procurement. There's different alerts that you can see. It's really a very good repository of what the UN is. It also contains our annual statistical report for the whole United Nations that is prepared to show you what we buy in different commodities, and you can drill down per agency, per year, per code, per commodity. If you take some time to look at it, you'll learn a lot about what the UN is doing for your particular field, and then you'll understand where opportunities will be coming up. The next step is to decide from your side if you have never bid. If you have, but you're seeing you got a expression of interest and we contacted you. And it's important to always respond to the expression of interest. Even if you don't know if you will be the best one for that, at least you'll get access to the bidding documents. The UN does not publish its bidding documents, so you have to express interest to us so we can share it with you, because we do it at a one-on-one level. And when you get the bidding documents, it's important to read them and understand how the bids will be evaluated and what we are requiring. Why do we do that? Because you have to read, for example, what I said, how many years of experience does the company need to have? Does the company need to have some quality certifications or specific certifications? And that way you can identify your business strengths and weaknesses and identify if there are actions that you need to take to close any gaps. Oh, is my ISO, for example, or equivalent expiring and I want to submit a bid? I should work on getting at least the document that says that I'm getting it renewed, so I have that ready to submit a bid. Business should be honest with themselves at this stage and understand that it's better to be patient, prepare everything, be sure, understand what we're actually looking for. Most of the time, the mandatory requirements in the solicitation will always be similar. So if you know that, then you'll be able to better prepare. One of the key tips I want to provide to you is that when you decide you're going to bid, you say, I'm going to bid, this bid is for me, I sell pharmaceuticals, I can do this. You should have an in-house tendering data repository. It's a comprehensive library of key tendering information that will save you time and effort when you're preparing a bid. How do you do that? You you start by saving, for example, an executive summary of your company background, company policy documents, technical specifications that you've already complied with, quality statements, financial statements, things that are sometimes difficult to compile for a bid. If you already have them compiled and keep them updated, it's going to be easier to prepare a bid. Usually those things are always requested. Give us a summary of your company experience, how many years you have, what clients have you had, references from your past clients. If you have all these things prepared, then that's half of the bidding of the proposal done. And so it will save you a much needed time for what? To plan your bid, to know the strategy that you're going to use for that solicitation, to understand, I need to prepare all these documents. This is how I'm going to elaborate my bid. Who's going to work on my bid? Is it going to be, do I need the finance people to provide me documents? Do I have the salespeople, of course, preparing? I have my technical people preparing responses to specific specifications and SOWs. And with that, you can prepare a timeline of activities and see if by the deadline, you'll be able to submit a bid. And if you think that the deadline that the UN is presenting is unrealistic, then you can always present an extension request in the clarification portion of the solicitations, which always happens in all solicitations, and the UN will see it. And if several suppliers always say that it's unrealistic, we will extend it and you will have enough time. That doesn't mean that you should sort of sit down and relax, but it means that you'll have enough time to prepare everything. And to prepare everything, now that if you have a plan and a timeline and you have your repository, you have to think like a buyer. You have to think like, we don't know anything about your organization, even if your organization is famous or you've been working with us for a long time. You have to assume that in the bid, the person that's reading the bid doesn't know your company, and you have to answer questions as fully as possible. An example of a sad thing that happens is that sometimes we work with bidders, and because we work with them, they get complacent and they don't submit documents that we know they have, but because they're not part of the bid, we cannot evaluate. And remember, those principles that we talked about before say that we have to treat everybody fairly. So if in the document it says you need to submit a document and you didn't, then we're going to fail you. And it's sad because we know that the supplier has that capacity, but we're missing it. So read the instructions, respond in line with the criteria. When we do invitation to bid, which is usually standard goods that can be just replenished, like consumables and pharmaceuticals, then we do pass-fail. So the technical spec of the item and the mandatory experience and certifications, that's a pass-fail. If you don't submit something or if you don't provide enough information for the item that you're bidding for, then you're not going to get a pass and you're not going to move on to be considered for award. But there's also requests for proposals where we consider a combination of quality and cost, usually 60-40, 60 quality, 40 cost. And there you'll have mandatory criteria, which is the essential experience or quality certifications, background, and then you'll have scored criteria. And when you see a list of score criteria, the tip I'm going to give you is the order of criteria matters. So the higher up the criteria is, the more points it's going to be scored at, just so you consider that. And because we're going to consider that every single criteria, you have to be precise, substantiate your responses with past experience evidence. Make sure that you do that. The key takeaways for this section is register, select the right tender, and identify your evaluation criteria. This is the last bit, so bear with me, but I think it's important. Another key success factor is maximizing your competitive advantage. Every single company has a competitive advantage, has something different, has a better product or a better supply chain or better lead times. So demonstrate your added value, demonstrate your strengths in your bid. Make sure that we can see it in your bid. Keep your competitors in mind. Know that they're doing the exact same thing and ensure you can bring a better value and that it's actually written down in your bid. And set your prices realistically. Don't go too low that you will not be able to recover, or if there's something that happens in the market, it'll be crashed. But also be competitive. Remember, we're looking for several suppliers, and sometimes in average, we get 10 to 15 bids to all our solicitation. So remember to be competitive. Another key, study the terms. There are different terms and conditions in a solicitation and a tender. read the contract template. We always provide the contract template. There's no secrets. We're telling you how it's going to be, how we're going to formalize this relationship. The contract template has the UN general conditions, and they are very different from, be it your local public procurement or private procurement contracts. So it's important to share it with your legal counsel while you're preparing the bid. Because as I said, we have a clarification portion. So if there are questions, it's better that you ask questions on the contract in that moment than to wait until you are proposed to be awarded. And then your contract and legal counsel wants to ask 25 questions that will take about 25 days to respond, that will delay the whole efficient and agile process that we're trying to look for. So please make sure you involve your legal counsel in your preparation of the bid so they can ask questions and you're prepared to understand the legal terms of the UN. One of the biggest things that is always a question is UN privileges and immunities. The UN is an international organization. So it has privileges and immunities and does not adhere to national laws. So if you're looking to have that you will be going to the court of blah, 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 that will not happen. We will go to international courts and to arbitration. That being said, the UN is a very non-confrontational organization. We always find a friendly way to solve our issues with our suppliers. And in the 10 years I've been working the UN, I have never been part of an arbitration process, but it's important to understand that it's different, that you have all the legal resources, but they will be more in the international law way than in the commercial national law way. We provide tender templates usually. Why do we provide tender templates? To make evaluation quicker and easier. If you don't fill out the tender templates, we will not disqualify your bid, but it'll make it so difficult for us to evaluate the bid that sometimes it'll take us maybe an additional month. And if we receive 10 to 15 bids and everybody doesn't use the tender template, you can see how the process turns into a very long one. So please use the tender templates. And if you don't understand them, ask questions in the clarification documents and prepare a bid document that you are proud of. Your proposal should be professionally presented, proofread if possible. Present a proposal that makes sense, that is organized. If you're presenting in a PDF, because now because e-tendering systems are now allowing to submit in PDF, that has an order, that we know where to find your documents. Don't submit 25 PDFs that have no order, because it just makes it harder for us to evaluate. And we also, that's your calling card. That's how we're seeing you when we don't know you. We're seeing you as a disorganized vendor. So the most organized your proposal is, it's your calling card. Be precise, identify details that are important for the compliance of the criteria, and highlight them so it's easier to read the proposal. And remember, quality is better than quantity. So make sure you submitted everything, but a proposal is 500 pages long and says the same thing that one that is 100 pages long will always be more welcome. And finally, if you're not successful, please don't lose heart. The UN is a complicated institution. It's an organization that has huge bidding documents and it can be scary. But we have a procedure where you can get feedback if you participate, at least in high value procurement, to get information on why you were unsuccessful through a debrief process. We will tell you what the weaknesses were of your proposal, what the strengths were of your proposal. That way you can take note, improve for the future, and the next time you submit a bid, you might even be successful. Usually bidders, it takes them maybe 2 tries to be successful and win a contract, because you have to learn the process, and the process is complex. But please don't lose heart. Don't give up, and ask for a debrief to understand how you can be better. Thank you very much for your time, and I will, after all that information, I will leave it open for questions. Allow me to stop sharing.
Fantastic. Thank you very much, Marta. That was a huge amount of information, hugely useful. Right, so we have a group of around 10 or 15 organisations that are part of our trade mission who are on the Zoom call with us. Guys, I can see you all on screen, so if you'd like to put your hand up if you've got questions, and I can give you the opportunity to come in and ask Marta directly. I think what I'll do actually, I'll get started myself. One question that immediately sprang to mind for me, Marta, is the one around, you're obviously supplying a huge number of different countries and different jurisdictions, but you're supplying the UN rather than supplying to those countries. What does that mean in terms of duties, taxes, customs? Are you exempt from those things because you're supplying the UN, or do the local laws apply?
Well, that's a very good question. We have, as I said, host agreements with the nations where we're working. And so there, any UN supplier for the specific purpose of bringing in an actual item or a good or a service, that in that sense, we are tax exempt. However, the supplier is not tax exempt from its own duties inside his own country of origin. But for any import duties, they're completely tax exempt.
Okay, that's helpful. Right, guys, who would like to come in with a question? Okay, I've got, is it Ethar and Ali? Do you want to just identify yourself and your company? That's okay. And fire away.
Yeah, thank you very much. It's Ether, yeah, just like the anesthetic, which is, so it's good that we're talking about medical stuff. Okay, so I've just got a quick one. Now, we've been part of the UNGM for quite a while now. Actually, we've been on a lot of stuff, and we've, dare I say, withdrawn from a lot of stuff when we've seen it is not quite the right sort of fit, which is great because actually you don't want to kind of do something you're not good at. But also, there are sometimes situations where we deliver a solution that's actually a cross-cutting benefit. So, for example, you talked about innovation or meeting 17 SDGs. Those are kind of cross-cutting benefits, which aren't often scored in tenders. So, from our perspective, there's not. You can imagine tendering is a very expensive process. So, what is the best way for us to include that if it's never going to be evaluated anyway?
Well, I think that's a great question. I think the UN is moving towards to having sustainable criteria. It is for the United Nations Secretariat, it's a little difficult because every change that we make to the way we conduct procurement actually passes through the General Assembly, which is a very complex situation. As you might imagine, 100 countries have to approve our new methodology. But what we are doing is considering, as you say, as I said before, total cost instead. So if a cross-cutting solution, and we start to evaluate the cost, for example, of an equipment that, okay, it might be a little bit more expensive at the purchasing price, but it will last longer and it's reliable. So that's an added value. We call it, I call it the 4 A's: affordability, accessibility. So if it's accessible, if it's easy to use, all these things are super important for us. And there we usually use an RFP where we have the quality and cost. For standard things like a syringe, it's really difficult to show innovation. But for equipment, for example, it's fundamental, or for services. So there you will see so that's the way we're incorporating it without having to change the whole procurement landscape while we're working on getting those approvals. So I would say that would go to what I talked about, maximizing your added value. Mentioning how durable your solution is, mentioning how maybe you don't need to give maintenance to the solution every month, or you could do it virtually. So that means I don't need to spend money flying in a technician to some place. That's how we see it, and for that we do have criteria. So it's not going to say innovation, it's not going to say sustainable development goals. It'll go towards how do we make sure that this purchase that we're doing is durable and reliable, and it's the best in a combination, an optimal combination of performance and reliability, but also cost in the long run.
Great, thank you very much.
Thanks. Right, anybody else got a question? Sue Kinganda from Spirit, do you want to come in?
Yes. Thanks, Steve. Hi, Marta, and thank you for that presentation. It's been very informative. My question is actually an offshoot of Steve's, which is we are a digital health company, and the platform we provide is a remote patient monitoring solution, to connect patients and clinicians and offer that remote access to healthcare as well. My question would be, would the same sort of principle apply because our platform is a medical device solution? So would the same principle apply as what Steve asked about the taxes? Because each country has their own medical device regulations? And I'm just wondering how it would work if the UN did procure something like this.
If the UN procures it, as I said before, we have tax exemptions inclusively. If we would to procure a digital solution, it's usually procured centrally for the Division of Healthcare Management, where we have the medical director's office. So they set up anything that is a platform for medical information, because we need to ensure, of course, confidentiality. So it's usually not bought at a decentralized level. It's bought at a centralized level, and for that we would buy it at HQ, which is New York. And for example, in the United States, we're completely exempt from taxes. It's been known that when you're inside the UN, it's not U.S. territory. So even if you would have to pay something, we would give you a tax exemption letter. So you would have that available. So we have that possibility in many other places, but for digital platforms and software, we have that all the time. The IT procurement team that usually handles this in conjunction with me, they have all those bases covered as well. So that will not be a problem at all.
That leads on for me actually with a slightly different question, Marta, which is the question about regulation. So if you're supplying a device or a piece of software or whatever it may be, or a piece of equipment, how does it work if you're supplying the UN in terms of regulatory compliance? Because clearly if you're supplying to an individual country, your device or item has to be conversant with those standards. So how does that work with the UN?
So as I said before, because you're supplying to the UN and for UN use, if it were, for example, WHO, it's different because WHO is supplying for ministries of health. So anything that is purchased by WHO is going to be handed over to a beneficiary. Anything that you're purchasing through the UN Secretariat is for the UN Secretariat's own use. So you don't your device, for example, if it's devices or your pharmaceuticals, do not need to be registered in that specific country because they're being imported by the UN and used by the UN. That's the big difference. It really depends on who is getting it in order for that to work. And for our case, it's very specific. There's no need for devices to be registered in a country. For example, we have been buying PCR machines to conduct COVID testing, and certain PCR machines are not registered in the countries that we're sending them on. But we have checked, for example, WHO regulatory approvals, and we have been looking into having at least 2 very stringent federal approvals. For example, we consider the NHS approval, we consider the FDA approval of certain items. And if those items, if what we're buying has these approvals, that's good enough for the UN, and therefore we bring it into a country. But the host nation does not ask us for it to be registered there.
Okay, any more questions from the floor? Mike, I don't know where you're from. Can you tell us who you are and where you're from, please, and give us your question?
Sure. I'm actually in Liverpool, and the company I represent is Horizon Strategic Partners. And Marta, the question I want to ask for you, to you is, that was a really comprehensive and interesting presentation, but it's very much focused on the UN going out to tender. If there are innovative products, platforms, or platforms, a digital platform that's used within the NHS and lots of countries overseas, but you don't perceive that you have a need for it, is there a way in which I can promote my product to the UN? Is there an innovation centre that look at new products and new services that you may not be tendering for, but you may not be aware of?
We're always interested in learning about new products because if there's not a need, it's always important to keep abreast of what's going on. As I said before, we have contracts we try to have long-term contracts, but that doesn't mean that we are not interested in knowing what's out there. So if you want to introduce your product, if you want to show it to us, we are always open to having sessions. We invite the key stakeholders. They take a look at it because we consider it for our strategies. Our strategies are 3 to 5 years. So if we see a product that is interesting, we're going to talk to you, look into it, see if there's similar products, and maybe we'll in 24 months you'll see a solicitation for that because we've learned of that innovation. So it's always interesting for us, and please do not hesitate to send your information through the trade delegation if you want to introduce your products to us.
Okay, thank you.
And we had a question from the other mic. We got our mics confused. So other mic. I think you're on mute.
There we go. My name is Mike Pritchett, International Sales Manager for Anetic Aid. I'd just like to ask Nata, do you hold stock of items that are required urgently, like the Red Cross and International Red Cross, so that they can react to situations? And how does that feed through to being awarded a contract? And how long have we got to make it? Now, we're involved in the COVID crisis at the moment, and we saw our delivery dates extend from 4 to 6 weeks to 20 weeks overnight. How do we react to that, and how would the UN look towards having to extend those dates during a crisis where you're already supplying other people? We supply the Army in the UK and the Red Cross and others around the world that all want the same product all at once, and then you would come in and you would want it as well. So how do we balance that with our production schedules?
Thank you, Mike. I think that's the story of my life in the last year. So I feel you completely, and I understand. I think you had a two-part question, so I'm going to start with the stock. So the thing that has saved us in the last year has been that we have held a small strategic deployment stock. We have a UN Global Service Center in Brindisi, Italy, which is located in a good way to move things out. We also have a service center in Entebbe, Uganda. So we have held more or less a small stock, a strategic stock that for when we needed to deploy new missions, like I talked about before. And with that saved us a little bit in COVID because we had access to some stock. We also had a strategic stock that we had from the Ebola crisis for PPE, for example. So we were in a much better position because we were prepared than other organizations, thankfully. That being said, we had our global systems contract holders. And of course, when the crisis happened, the prices that were on the contract were completely unattainable, and the deadlines on the contract were also completely unattainable. The UN will never implement clauses on a contract when, of course, these are not obviously not attainable. What we did in that case is that we conducted emergency solicitations, short-term, very to the point, not 6 months or 2 month solicitations, but 2-week solicitations, where it was dynamic and we would accept proposals really quickly, so we wouldn't lose the deadlines that you were getting. So if you got a lead time of 4 weeks, we knew that we were moving some of that stock out, so we were replenishing that stock over and over again in the last year. And that's what we will be doing now as well. We currently have a good strategic deployment stock, but the solicitations I was saying that we're coming up is to replenish that stock, and we're revamping that stock. So we're thinking of having anything that is needed to a strategic stock to have, for example, a style of a level 2 hospital. Anything a level 2 hospital will need, that will be in that stock. And we will be conducting replenishment solicitations for that. And that's why we're looking for new suppliers, because we do partial awards. So if you can give me 5 things in 4 weeks and then somebody can give me something else in 2 weeks, everybody will get a piece of the pie. And that's how we replenish stock. We move really quickly, and we have a lot of procedures that help us do it in emergencies like COVID, but also regularly. We just start looking, we have a demand management and warehouse management, and we check it. And whenever we see that it needs to be replenished, then we go out either to our global systems contract holder if it's normal times, or if it's emergency, we conduct emergency solicitations as well.
Okay, we've got about 2 minutes left. Have we got one more question? Anybody else got a question? In that case, I've probably got one more, I think, from my point of view, which is really one around timescales. You talked about the fact that you have sort of sort of more long-term procurements, but you also have emergency procurements. Can you just give us a quick idea of what the kind of, what are the lead times for the more, I guess, leisurely procurements, and what sort of lead times are we talking about when it is an emergency procurement?
Absolutely. So historically, the UN has been is a very large organization, and we have a lot of checks and balances. So all solicitations have to give enough time to ensure the fairness and effective competition. So if it's not an emergency, we try to give enough time for responses. We try to give enough time to give you clarifications, and that gives us about between 20 and 40 to 60 days just to prepare a bid. And then, depending on the level of competition, as I said before, we have been very lucky that we have been receiving 10 to 15 bids. That means we need to evaluate 10 to 15 bids. So that usually takes a long time. We try to do it between tops a month or two. We are trying to expedite, to be more efficient. That's why we've implemented the use of templates, because it was taking a long time to evaluate. To be honest, the process was taking before about 6 months. Now the process has been downsized to 3, which is, I think, a decent amount of time, because in the past there were many steps that were being too long, or that we didn't implement efficiency strategies. And now a regular process should take about 3 months to be awarded, unless, of course, there's something completely out of the blue, but it should take 3 months. We're also considering the use of bid bonds to make it easier for you to bid, and we're also considering the risk of each solicitation to reduce the quantity of performance bonds that we're requesting. So those are all improvements that we're looking into to make the solicitation process short. And with regards to emergencies can be up to, we give you a week to respond, because it's an emergency and we need to deploy as shortly as possible. And usually when we do that, if you download our procurement manual, there's the emergency procurement procedures. You can see how it is that we do things. But basically, we establish the criteria. We always look for a pool of suppliers that may have already been participating, and we invite those. We also publish it, but if we have your names, if we know that you're capable of doing something, we'll invite you directly. That's part of the emergency. We'll go in UNGM and find people. We'll grab from the business seminars people, and we'll give them sometimes 5 to 10 business days to respond. In COVID, we were giving people 4 business days to respond, because we knew that they also needed to respond back to whoever was applying to them quickly. Then we were giving responses to them in 48 hours, evaluating in 48 hours, and awarding in another 24 hours. So it's a very short time frame.
Thanks so much for that, Marta. And thank you all for your questions. Thank you for being part of today's session. It's been really, really interesting. Obviously, some great opportunities that we should be looking at from the UN. That's it for today's session. We have another session tomorrow. There's a main stage session at 10 o'clock tomorrow morning, which is going to be fascinating. It's on the future of aid funding in a post-COVID world. I look forward to seeing you all then. Thanks very much for coming along today. And Marta, thanks again for being a fantastic speaker. Thanks, guys.
Thank you so much. I hope to hear from you all. Bye.